Alrighty, good morning, everyone. Welcome to another coffee chat with VPLC. My name is Ezra. I am the director of the Center for Outreach at VPLC, and I'm going to be in the background as your host. Hopefully you all have a nice beverage, coffee, tea, or something else. You can't really see it very well, but I definitely have a coffee next to me to get started for today. So just before I turn it over to our presenters today, just a reminder, this is being recorded and will be uploaded to our YouTube channel sometime later this week or early next week. So be on the lookout for that. I will send a follow-up email with that recording in case you'd like to share it or watch it again if you have to jump off a little early, all of that good stuff. If at any point you need any technical assistance, you can always direct message me here in the chat. And also please do post any and all questions that you have in the chat as well. We'll be checking that throughout. We're only going until about 9:30 today. So nice short conversation, but hopefully one that gets you started thinking about the public health emergency. And thank you for sharing about your coffee. I love to hear it. So if you'd like to share about what you're drinking this morning, I currently have a Tim Hortons coffee with coconut creamer. It's pretty good. All right. With that being said, I'm going to turn it over to Cassie and Sarah.
Good morning, everyone. So I will say we're going to try to start thinking about the end of the public health emergency, not just the public health emergency, since we've been in it for 2+ years at this point. My name is Sarah Cariano. I am the health policy specialist here at Virginia Poverty Law Center. I'm going to be talking a little bit about the end of the public health emergency and how it will impact Medicaid. And then Cassie's going to talk a little bit about SNAP. Because it's a pretty dense topic, I do have some slides I'm going to share. I know this is generally a more casual forum. So I'm going to go through them quickly and just kind of talk through them, but just have them there for reference for everyone. So just give me 1 second while I get that up and then we can get moving. All right, so part of what was passed in the Families First Coronavirus Act way back in March of 2020 was this maintenance of effort requirement for Medicaid. It said the federal government is going to give all the states an extra 6.2% of their share of the Medicaid program, right? Because Medicaid is jointly funded state and federally. So the federal government is giving all states more money if they meet these specific requirements. So they can't make it harder to get Medicaid. They can't move someone off the Medicaid rolls or into a lower coverage category of Medicaid with a few very slim exceptions. They can't make it more costly. So the programs that do have premiums can't increase those. And they had to require COVID testing, treatment, and vaccines. All states took these options. It's been a pretty big financial incentive. Virginia has actually saved. We've kind of like made money through doing this, even though, as you'll see on the next slide, we've enrolled a lot more people. So because we've not been able to disenroll anyone from Medicaid, our Medicaid rolls have really, really increased. We're over 2 million members for the first time ever in Virginia. That's about a 30% increase during the public health emergency. DMAS, the Department of Medical Assistance Services, which is the agency responsible for Medicaid here in Virginia, estimates that when it ends, we are going to be allowed to start disenrolling individuals, and I'll talk a little more about what that process looks like. We'll lose between 14 and 20% of those members, which is up to 400,000 individuals will likely be coming off the Medicaid roll. So they will have to find coverage elsewhere. And that's going to be within, a year period. And so a good amount of work helping individuals transition from Medicaid to something else. Within that 400,000 are folks where they're probably going to be improperly terminated because maybe they didn't return a notice, they didn't get the mail, there was some administrative reason that they were terminated, but they are actually still eligible for Medicaid. And so those folks will hopefully be able to help them get back into the Medicaid program. CMS has released several rounds of guidance as to what will happen when the public health emergency ends and what states are allowed to do and what they will be required to do, and some limitations on what they cannot do as they're going through all their roles. And so right now, public health emergencies, I'll step back a second, are only extended for 90 days at a time. And so we've been extending them, every 90 days since March of 2020. The current one we're in does end in mid-July, but CMS has promised states that they will provide at least 60 days notice before they end the public health emergency. And so we are all but certain to be extended again for another 3 months. And it's very possible extended again past that. We're hearing likely at least January at this point, but there's no kind of absolute certainty in that. But we are very, very pretty, it's going to be extended for at least another 90. And then if, when we're within 60 days of the end of that, if the CMS has not said it's going to end, we're in the same situation. We're like, all right, it hasn't been extended yet, but we're 99.9% sure it will. But when we do finally get to that point, people will be able to start being disenrolled the month after the public health emergency ends, and we'll continue to get that increase in the FMAP, that extra money from the federal government, until the end of the quarter that the public health emergency ends. At that time, all cases that are overdue, which are a lot, as well as all cases that hit their regular annual renewal date, will have to go through a full renewal process. And so we are not allowed to start saving names in cases where where the state has information where that person is no longer eligible. And as soon as the public health emergency ends, just disenroll them. Every single member has the right to go through a full renewal to ensure that at that point in time, they're not eligible before a disenrollment occurs. Partial renewals can only be done if the individual has successfully undergone a full renewal within the last 12 months. So if someone is newly enrolled and reports information, they can do a partial, but kind of short of those circumstances, a full renewal has to happen. And they can hold reports of changes until the renewal date, right? Because this is going to be a 30% increased caseload. So our DSSs, which are already understaffed, are going to have a lot more cases to work. And so if holding a reported change until the renewal date comes up helps them, they are allowed to do that. The renewals should be distributed throughout the year. Virginia is looking to use a full 12-month period to go through all the renewals, as well as using this time to kind of spread out the caseload. Right now, we have kind of natural spikes. When we first launched Medicaid expansion, there's a spike. Usually we have a spike in enrollment during the ACA open enrollment. And so using this to kind of smooth out those renewal dates across the year. And CMS will require reports, and they'll be monitoring states pretty closely during the process. So how much time will they have? The states will have 12 months to initiate all renewals once the PH ends. They have an additional 2 months, so they get 14 months to kind of clean up. So that renewal process takes a couple months to get through, and so they have a full 14 months to kind of finish going through everyone. I kind of already talked about this with the timeline a little bit, so I'll just skip forward. What that means is states have the option to kind of initiate renewals, but not disenroll anyone up to 2 months before the end of the PHE. Right now, Virginia is looking at starting that process of renewal the month in which the PHE ends. So that would mean no terminations are going to happen until after, about probably 2 months after would be the earliest that we'll see people being removed from the Medicaid rolls. Yeah. I just also wanted to shout out, there's a bunch of other flexibilities that states have taken during the public health emergency. They're what are called emergency waivers or emergency state plan amendments, disaster state plan amendments that are only available when we are in a federally declared public health emergency. And through these, we have adopted a lot of kind of flexibilities for our providers, flexibilities for enrollees. These are ones I've listed that we are using and have been using that will go away when the public health emergency ends. So usually, for example, you have 30 days to file a Medicaid appeal. Right now, that's waived. You can file a appeal late and they have to kind of accept it. That will go away. Copayment suspensions. I will say copayments were removed from the FAMOUS program in the pending budget. And so if that kind of stays in and the governor signs it, we're going to have that going forward, which is really wonderful news. Same with a lot of the telehealth flexibilities, ones that we could make permanent, the state is moving to make those permanent. And also the fifth one down, legally responsible individuals, so parents and spouses. It was pretty limited in the circumstances in which they could be paid caregivers prior to the public health emergency. Now they can be paid caregivers, so providing kind of personal care hours to medically complex children. And the budget also directs the state to submit a permanent waiver application to make that a permanent flexibility within our Medicaid program. I know that's helped a lot of families. It also helps alleviate some of the pretty severe staffing shortages that we're having in some of our personal care agencies and things like that. And they're also allowed to accept updated contact information from the MCOs, which is huge, because one of the biggest reasons we fear people are going to get improperly disenrolled is that they don't get their mail. They've moved, they can't get contacted, so they don't know that they have to return a renewal notice. And so that, let me skip this, kind of brings me to my next slide as to what we expect to happen with folks. So just really high level, I'm not going to talk through each of one of these, but folks can either get renewed automatically or renewed by returning their packet, and they can get renewed in the same kind of Medicaid they have, or they can get moved into a different kind of Medicaid. Some might be moved from a full benefit to a limited benefit plan, and even that, while it's not a termination, we can probably try to get them an ACA plan or another kind of plan that's a full coverage plan. And we should look at those people, not just the people who are totally losing coverage. And then the types of terminations we expect to see, again, really high level folks who are just no longer eligible. They've gotten a job, they make more money. A child has now aged out of the child category and the income limit's lower for adults. And so they're just not eligible anymore. Someone might be ineligible for the time being, but able to reestablish their eligibility. So if someone has saved some of their stimulus checks and they're now going to be counted as resources for them, they'd have to send those down and reapply to get kind of regain their eligibility to still meet the resource limit. Then folks who are ineligible and just need to transition, right? We're going to get them into the marketplace, maybe employer. There's at least a good number of folks on Medicaid expansion, which is only supposed to go through age 64 and is not for individuals who are Medicare eligible, who are now 65 in Medicare or Medicare eligible. And they're going to have to make that transition over to Medicare and see if they're eligible for some of that extra help that Medicaid offers those individuals. But those rules for people who are Medicare eligible in Medicaid categories have a resource. They look at income different, right? They're different rules. And so that's a really big kind of tricky transition that some folks are going to have to make there. Sorry, I had that slide in there twice. And so what are we doing now, right? Like I said, this is all coming. We don't know when it's coming, right? So it's really hard to plan. And so what we're doing right now is kind of stuff like this, where we just want to make sure people are aware that it is going to be happening, that it is not imminent. I think the three kind of really important things when we're talking with members is going to be, if we know it's someone who's going to have to transition, helping them make a plan, making sure that they know that as soon as the public health emergency ends, all like 2 million plus people are not going to get the renewal. It's going to be spaced out. And so they just need to make sure that the state has their updated contact information and that they're watching their mail and waiting for their renewal notice. And so that when that happens, they can take whatever steps are necessary to ensure they either stay in coverage or can transition without another form without creating a gap in coverage. And we really just want, our partner organizations to know what's going on, because we've already started to hear some kind of like percolation of misinformation among members about what's happening, when it's going to happen, what they're going to be required to do. And so that's, one reason we wanted to have this now is just to kind of start the conversation with our partners and make sure we can be there to answer questions and connect with members if they have questions. And on my last slide is just a reminder that Virginia Poverty Law Center is a Navigator grantee for our Enroll Virginia program. So our Navigator program is an ACA and Medicaid enrollment program that we've been around since 2013, since the first year of the ACA marketplaces. And we're across the state. We help people with Medicaid, we help people transition. And so if you're looking to either connect members in your community to one-on-one assistance, or you're looking to host kind of an educational forum of some kind, please reach out to me, please reach out to our sisters. We'd love to partner with you in any of those ways. And on that, let me check the chat and see if there's questions, and then I will, thank you, Ezra, for putting the Enroll website in there. Spend on transfer over to regular. So let me go all the way up. Spend on Medicaid versus regular Medicaid. Spend on Medicaid is when you make too much money for a regular Medicaid. And so you have to accrue a certain number of medical debt bills that you've paid and literally spent your income down to a certain amount. And then they're for 6-month periods at a time. This is a very basic case. Cassie's going to be like, sorry, this is like not nearly as detailed as this explanation should be. And it's only 6 months at a time. And so usually people have to kind of recertify every 6 months. During the public health emergency, folks have been able to stay in their spend down and maintain Medicaid. And so that means they've probably accrued some extra resources. And that's going to be another one of those really complicated set of very complicated cases for folks to have to reestablish eligibility if they can. You do not have to be a US citizen to get Medicaid. There are some pretty strict immigration requirements. That would be another like hour-and-a-half training, but Carmen, feel free to reach out to me directly. I can talk about immigrant eligibility for Medicaid for hours, and I would be happy to do that with you. And Deepak did put in a quick eligibility guide in the chat. The main thing to think is women, pregnant women and children, all you have to do is be legally residing for the most part. So if people are here legally, have any kind of documentation, they can get Medicaid if they're child or pregnant women. Undocumented pregnant women can now also get Medicaid in Virginia. Non-pregnant adults, there's some pretty strict criteria that, again, I'd be happy to talk through. Patient pay and long-term care. Cassie, I'm gonna let you take that one, if you don't mind.
Sure. What was the?
So what does this mean for copay patient pay responsibility for those in long-term care?
So if I'm not answering the question correctly, if you were thinking of something else, please let me know. But during the federal health emergency, you couldn't also increase patient pay obligations. So once the federal health emergency is over with, people will then see their patient pay obligations go back to where they normally would be. And there's probably, I think this goes back to the whole resource issue. There's going to be extra resources. I know in the budget, there was something that, would allow them to like waive these particular resources. So that would be great, because I'm sure I've seen people that went from community-based care to nursing facility, and the patient pay obligation is vastly different in those two. So I'm sure there's a lot of people that have been accruing resources there.
And I will say the budget language is specific to that situation. So resources accrued because someone went from community-based care to a nursing home and the patient pay wasn't adjusted, and it's waiving it for 12 months. My concern there is someone who doesn't get the renewal till the end of the public health emergency, then it's only waived for like a month, versus someone at the beginning has the full 12 months to figure out how to properly use those resources, right? And so again, it's a lot of planning with these more complicated cases.
And in the beginning, the nursing facility was keeping this money. So I don't know if that's changed. So that could also be concerning, that the people just didn't have access to spend it. I don't know. Like I said, I was at the beginning. I don't know and it shouldn't have been that way, but I don't know how it actually ended up later in the pandemic.
The qualifications, it's through for a parent to be a paid caregiver is through the consumer directed process. And I'm not sure what it will look like when we move into like the official waiver, the permanent waiver, because that has to go through the CMS process. So we'll definitely be keeping an eye on it. I know there's like, this is a really good thing. We want to make sure there's proper, guardrails in place so individuals are still gaining as much independence as they possibly can. And so that's, those regulations are definitely something we will be watching in conjunction with some of our partners and individuals in the disability rights community specifically. And we talked about that. All right, and Cassie, I know I've like projected age on to Medicare. What is it? So Lisa, your question about the Medicare SEPs, there is actually, CMS has a proposed rule out right now for comment, establishing a Medicare special enrollment period for individuals who did not enroll during their initial enrollment period because they were in Medicaid. I was actually hoping and advocating for a special enrollment period specifically for the end of the public health emergency, and this is way broader. It's across the board. It would be a permanent SEP if it went in place as written. And so we're really hopeful that that will remain in place and help individuals get kind of into Medicare and not just be able to get a supplement, but also not have a Part B penalty, not have a Part B penalty if they didn't enroll in those because they had full coverage through Medicaid at this time. And then the next is a SNAP question, which I think is a wonderful transition for Cassie. And then Rachel, I'm going to put, the state has a website with all of their outreach toolkit on it. And so in the, just for time purposes, I'm just going to put that link right in and let Cassie take over and talk about SNAP.
Can I mention one thing about Medicaid and then I'll transition to SNAP? For the, just a friendly reminder, individuals that are eligible for full Medicaid or that are eligible for qualified Medicare beneficiary, the state does pay for the Medicare Part A premium if it's not free. So individuals that are 65 and older and don't have those 40 quarters, they may still be, if they're financially eligible for Medicaid, eligible for Medicaid, full Medicaid or QMB, they can get that Medicare. And the good thing about that is Medicare usually has larger networks. So just a friendly reminder there. And then now I'll talk about SNAP. So there's not as much, the protection that you can't terminate Medicaid has been a very huge protection for many people in Virginia. Unfortunately, during the federal health emergency, you can terminate SNAP benefits. So there wasn't that same prohibition against terminating SNAP benefits like there was Medicaid. However, there were some SNAP benefits changes that happened during the federal health emergency. The biggest one is the emergency allotment. How the emergency allotment went is you were approved for your traditional SNAP benefits, and that could be as low as $20 a month, but you get the full emergency allotment for your household size. So if you're a household size of one that was supposed to only be getting $20, you ended up getting about $250 a month. You'd get the $20 around, the first of the month, and then the extra $230 around the 16th of the month. What has to happen is the state has to request each month for that emergency allotment. So it's approved on a monthly basis. You have to have both the federal and the state emergency. And Virginia has been approved for the June emergency allotment. That will end either if the state determines that they no longer want to request this, or a month after the federal health emergency. This has been one of the biggest benefits to SNAP. You can't buy a lot on $20, and the increases in grocery costs. So this helps a lot of people be able to afford their groceries. Another difference is that usually in order to be eligible for SNAP, you have to, if you can get SNAP, but after that 3 months, you have to work or meet one of the exceptions. Those work requirements have been waived during the federal health emergency. Now, county by county after the federal health emergency, they can look about what their workforce looks like and decide whether a specific waiver for those counties need to be in place. But for now, all of Virginia does not have a work requirement for SNAP. And the last big change was for students. There are special requirements for students, and the federal health emergency broadened that. So now you can participate in SNAP and not have those issues surrounding with you being a student if you're eligible to participate in a federal or state work study program, or if you have 0% contribution from your parents So it makes it a lot broader. So these were great changes. I think what we're concerned about not only is a lot of people are going to start, once the federal health emergency ends, to lose a lot of their SNAP benefits, is also how this interacts with the Medicaid renewals, because the DSSs are going to be slammed with renewals. They still have to do SNAP certification. People don't get their mail. So that not only affects Medicaid, but it's going to affect your SNAP benefits if something happens and it's not timely recertified. And unlike with Medicaid, in Medicaid, if your benefits are terminated, but they shouldn't have been, you should have been, eligible, but they were just terminated for verifications. That could go back within, if you get those verifications in within 90 days, back to the day it was terminated. Unfortunately, SNAP benefits aren't like that. They're prorated. So you could see families losing out on a good chunk of the money that they're receiving. I will also promote our SNAP helpline. If you're curious whether you or someone else is eligible for SNAP benefits, we have a great SNAP calculator that you can just input your information. And then you can also, if you need help applying, we have a SNAP helpline, and that person is both speaks English and Spanish, and she can help them apply. I went very fast, I'm sorry. But does anyone have any questions? Did I miss any questions?
I know Sarah has been going through the chat diligently. Thank you for doing that. Sarah, go ahead.
Yeah, I was just going to say there were a few questions in there that I can just wanted to speak to out loud. First, returning citizens, individuals released from incarceration are eligible for Medicaid. I know there's about 400,000 coming out in the next 2 months. There is a process with DMAS and DOC to try to help people get enrolled almost prior to release, so their benefits are effective immediately upon release. I'm sure it won't catch everyone. So individuals who aren't enrolled should apply through the normal process. But any kind of conviction does not bar you from Medicaid. It's not like TANF, where there are these like extra rules for folks. When you're incarcerated, you can't, because there should be other funding through Department of Corrections to pay for healthcare. But as soon as someone is released, they should apply, absolutely, if they're not already enrolled. And then there was a question about leveraging SNAP data. Virginia does use what's called ex parte renewal. That's the first step of the renewal process, where they try to automatically renew people. And we do it pretty successfully for our categories that don't have resource category requirements, or our Medicaid expansion, our children, our pregnant women. And because we have, DSS has a system that houses Medicaid and SNAP cases together, we're able to access that data pretty easily. And so we are pretty successful in that. So some folks who are automatically renewed through that process will just get a notice that says, congrats, you've been renewed for another 12-month period. Remember to report any changes. And then if they fall out of that process, that's when they'll get a renewal package that they have to fill out, complete, whatever information the state was missing. And then the state will kind of take that information back and attempt to complete the renewal. And I think those were the questions I answered in the chat.
Thank you both so much. I see there's one more question in there. Does the SNAP calculator take into account regional differences in grocery costs?
So unfortunately, SNAP, the program itself, does not. I know there are a couple of bills at the federal level that are coming out to make SNAP more accurate of how people spend groceries or purchase groceries, but it's not regional.
And because we are 1 minute already over time, there was so much information that you both packed in, and thank you for everyone for all of the wonderful questions. That's what makes this really a great coffee chat. Sarah and Cassie, do you have any last words you'd like to share, whether, how people can get involved or help in any way?
I would just say reach out, especially if you have kind of community connections in your part of the state and you want to connect with a navigator or sign up. Yeah, Carmen, we can put my email in the chat. Just email me and we can definitely chat. Enroll Virginia is also looking to kind of create a partner listserv where we can just share information as things change. And so we'll send that link out to sign up for that once we get it set up to individuals who signed up for this. And so if you're just trying to stay on top of stuff, make sure you can sign up there. And you can always sign up for the DMAS webpage, DMAS newsletters at covervirginia.org. And then you can get kind of their updates as well. But yeah, if you have questions, reach out because it's complicated and guidance changes and we don't know exactly when the dates are yet. So refer folks to us and please ask questions. We, most important, just want to get accurate information out and definitely need our partners to do that.
One last question came in. Oh, I think Cassie just answered it.
So that was, it ended up being a work study, and that work study was then vetoed. So next year.
All right. So again, if you want to contact Sarah or Cassie, I put their emails in the chat, which are sarah@vplc.org and cassie@vplc.org. Nice and easy. Again, thank you both so much for sharing all of this wonderful information. And thank you all for attending these coffee chats. We're actually going to have another one in 2 weeks on the 21st. We are having Valerie LaRue, one of our staff attorneys that works in family law, come and talk a little bit about the foster care system. Specifically, June is National Reunification Month. And so a lot of different information I know I'm going to learn from that. So be on the lookout on our social media for the registration link for that. And I hope to see you then. You will be hearing from me in the next week or so with the recording and other information that everyone has shared. And enjoy your coffee/tea and have a great day, everyone. Thank you, Sarah and Cassie, again.
Thanks everyone for coming.
Thank you.